the other one I was going to talk about was breast screening, and obviously it's already been mentioned today that breast cancer is really common. It's the most common cancer for women. And mammograms is the way that we do the screening. And these are a special type of X-ray that is designed to find the cancer at an early stage before it might be too small, when it might be too small for you to feel or see it. So, you should get your first invitation between the ages of 50 and 53. So it might be that actually you don't get your first one until you're just 53 or 52. And then what happens is every 3 years you will be invited to have this until you turn 71. But if you're over 71 and you'd still like to have screening every 3 years for whatever reason, then that's absolutely fine. And you won't be automatically invited, but you can request to be invited. And all you do is you contact the local breast cancer screening unit, or go on the NHS app, or go on the GP contact surgery for details. Vanessa, I don't know if you want to give us away, Vanessa. Vanessa's over there. It's got lots of information from the breast cancer team. And it's got lots of information there about how to contact the service. So if you still wanted to have a test done, for whatever reason, you can be absolutely entitled to do that. You just need to contact them and let them know. Obviously, if you're under 50, you also wouldn't be automatically invited for screening, and it's not available at the moment. There are a few cases where people would be screened under the age of 50. For instance, if there's a family history or something like that, or you might get a mammogram if you're referred up to the hospital. But for those cases, you would need to go and talk to your GP about that to see, I'm worried about my family history, I think I might need to have screening. I'm not going to go into that today, but certainly if you've got any concerns, then talk to your GP about that. But we're just going to talk about the routine programme for today. So, you knew you should get an invitation, comes through the post. They'll give you a date and time. Obviously, if that's not convenient for you, then get in touch with them, they can change it. And your invitation will either be a mobile unit, just on the picture, or sometimes done at the hospital, which will either be at Hinchinbrook or Addenbrooke. So it all depends on where you live to where your invite will come through. But really, when you're planning your appointment, or when they're planning the appointment, they want to make this work well for you. So if you've got any things, then do let them know. So if you need additional support, if the person having the test has got learning disabilities or there are mobility issues, then just let them know. Most of them have wheelchair access, so it shouldn't be a problem, but just let them know. If you've got breast implants, let them know, because sometimes they'll need to do a different type of X-ray or screen to get your test done. If you've got a pacemaker or other medical device, again, that can sometimes interact with the equipment. If you're pregnant, if you're already under the care of a consultant, if you've had a mammogram in the last 6 months for some reason, or if you've had COVID, this was when I was looking at, they were saying that you should let them know if you've had COVID in the last 5 days, because what that does is sometimes causes the glands under the armpit to enlarge, and that can be picked up on the scan, and just so that they know about it. But really, they want to make the appointment work for you and make it comfortable, make it easy for you, so just let them know if there's anything that's important. So at your appointment, the mammographer, the technician, nearly always a woman, you will be given privacy to undress, and then the mammographer will help you place your breasts into the machine. They will need to touch them, your breasts, to be able to do this, to get them in the right position. The machine does squeeze your breast to hold it in place. You will need to try and keep still as well for them to take the picture. It may be uncomfortable. It shouldn't last for very long. And if you feel that you can't carry on, let them know. It's a bit like when you're having your smear test. If there's any problems, just let them know. They will do what they can to help. They will need to take 2 different pictures for each breast from 2 different angles. That's what they will do. The X-ray itself only takes a few seconds. The whole appointment should be no longer than about half an hour. It might be a bit quicker. So some top tips really. Wear a skirt or trousers. You don't want to be wearing a dress or a jumpsuit, because you only need to be undressed from the waist up. If you've got any necklaces, nipple piercings, anything like that, try and take those off before you arrive. Deodorant and talc and powder can interfere with the results, so try not to use those for a few days on the day of the test. Roll-on deodorant's okay, but spray-ons and talc and powder. And again, if you feel nervous, if you feel uncomfortable, just let them know. They're there to help you get your test done. So what happens after your test? Usually you'll get your result in the post within a couple of weeks, and there's two possible answers. The first one is there's no signs of cancer, you don't need anything else doing at that time, and you'll just be invited again in 3 years as long as you're under 71. And this is the case, I've got the picture of the picture, this is the case, the blue ones, is 96 out of 100 women will find everything's fine, don't need to see you again. The other possibility is that you need some more tests doing. Important thing to say is this does not necessarily mean that you have cancer, but they do need to do some more tests, and they will refer you up to the hospital. And those could be a whole different number of tests depending on your personal situation, but you may be examined by the doctor, you might need another mammogram, they may do an ultrasound, or they may take a small sample or a biopsy. So 4 out of 100 women will need to go up and have those tests done, but only one of those will be found to have cancer. And hopefully, that cancer will be at an early stage. So again, lots of thoughts, lots of questions, what do you think? I haven't received a letter. Basically, if you're 53 and you haven't had your letter yet, your invite, then get in contact with the local breast screening service and check. Or if it's been more than 3 years since your last appointment, then let them know. You know, no system's perfect, things happen, just get in contact with them. Can you get screening if you're trans or non-binary? So basically, if a person has any breast tissue, they should be having screening. So if it was somebody that was assigned a female at birth and they're transitioning to become a man, but they still have breast tissue, and they haven't had surgery to remove it, then they should still have a mammogram. If you're assigned a male at birth and you're transitioning to become a woman, and you've had hormones, and they've been on those hormones for more than 2 years, which is encouraging breast tissue to grow, then they should have mammograms as well. Are there any risks? So it is an X-ray, but it's a very special X-ray, and the radiation level is very, very small. There is a very slight chance radiation from X-rays can cause cancers, but the level is very, very low, and the benefits of having the scans far, far outweighs that. And I think I covered, what to do, or is it painful? So please don't worry, please don't ignore your appointment, it's really important. So the thing with the screening programme, with the mammograms, is that can only check your breasts on that day. So in between your tests, or if you're not in that age range for screening, so if you're under 50 or if you're over 71 and you've decided to stop having them done, it's really important to get to know what your breasts normally feel like, so that you know what's normal for you, and then you can pick up any changes. But it's important to think about how those might change through your cycle and through your stages of life, because they will change, your breasts will change, whether it's different stages in your menstrual cycle, whether it's after the menopause, whether you've been pregnant or breastfeeding. So examining yourself is really important, just to get to know those changes. And these are the symptoms of breast cancer. I'll go through these. These are the changes that you're trying to watch out for. Lumps or swellings in the breast, in the chest, and right up into the armpit. There's breast tissue that comes up into quite towards your armpit, but also into the armpit as well, because your glands can get enlarged. Changes in the skin of the breast, whether it's dimpling or redness, rashes, Sometimes you can get what they call an orange peel appearance, where the skin gets thicker and the pores become much more obvious. It looks a bit like the skin of an orange. Maybe it's changes in the shape or the size of one or both of the breasts. Sometimes it can look like there's sort of tethering or puckering, because if you imagine if there's a tumour growing, it can sometimes be pulling on the skin. Changes with the nipples, if there's any discharge, particularly if there's blood in it, but maybe shape in the nipple, if the nipple becomes inverted. Some people naturally have inverted nipples, that's what they're born with, or it grows, but if it is a nipple that used to stick out but suddenly starts sticking in, then that's a change and that's what you need to look for. The other thing is about pain. If pain doesn't go away, you definitely need to get that checked out. But pain in the breast often isn't a symptom of breast cancer, because you can get breast pain through your cycle or for various other reasons. But if you have pain or discomfort and it's not going away, then you do need to get that checked out as well. But the thing to remember is that all of these symptoms don't always mean that actually there's a lump or there's a cancer there. They're very common, and there's other things that can cause these things. But if you notice any of these changes, you need to get it checked out. So, how to check the breast. So Vanessa's got some leaflets, so if you wanted to pick one up while you're here, just to explain how to do. So just very briefly, the main things to do is to, first of all, look at them first. Stand in front of the mirror and look at your breasts. Ideally, what you want to do is look at with your hands down and then with your arms up. So again, to look if there's any puckering or changes, and then maybe put your hands on the sides of the hips as well. But just have a look. Do they look the same as normal? And then feel around your breasts. I think one of the things I would say is to use the flat of your hand. It's not a prod poke like that. It's actually the flat of your hand in a sort of smooth circular motion. And you want to make sure you don't miss any of those areas. So whether you go all the way round, or you think of dividing your breasts up into 4 sections and just do one section at a time, and make sure you check each area, also checking up into the armpits as well. Have a close look at that nipple. Has that changed at all? Does that feel any different? Okay. Doesn't matter where you do it. Some people find it's easier in the shower, or you might want to do it when you're lying down. Obviously you can't do the mirror lying down unless you've got mirrors on the ceiling, but you might want to do that. I'm going to try and see if this will work.
Breast cancer can affect anyone, no matter age or gender. Getting to know what looks and feels normal for you could make all the difference. Checking monthly helps you spot any changes early. Look out for lumps in your chest, breast or armpit. A change in the shape of your breast or either side of your chest. Redness, rashes, dimpling or texture changes, like orange peel skin or thickening of the skin. Changes in the look or shape of the nipple, like inverted nipples or unusual discharge, if not pregnant or breastfeeding. And any pain that doesn't go away. First, look at your breasts or chest in the mirror with your arms at your sides. Then raised, then with your hands on your hips. Next, feel your chest using flat fingers, covering all areas in a spiral motion. Up to your collarbone and up into your armpit, with both lighter and firmer pressure. Finally, gently check around and over each nipple, checking for any changes or discharge. You might find it easier to check in the shower or lying down. If you have periods, it is best to avoid checking when on your period. Sign up to our free monthly text reminders to keep on top of checking. If you notice any changes in your breasts or chest, see your GP straight away. And remember, see it, feel it, check it. Know you're normal.
So, mammograms.
Breast cancer screening. What is a mammogram? And what does it look for? A mammogram is an X-ray of the breasts that checks for early signs of breast cancer, often before you can feel a lump. Why is it important to have regular breast screening? Regular screening helps find breast cancer early, when treatment is more likely to be successful. Who is eligible for routine mammograms on the NHS? Women aged 50 to 71 are invited for screening every 3 years. You'll get your first invite before your 53rd birthday. How often should women have a mammogram? Every 3 years through the NHS breast screening program. Can I ask for a mammogram earlier if I'm worried or have a family history? Yes. Speak to your GP if you notice changes or have a strong family history. You may be referred earlier. What happens during a mammogram? Is it painful? Each breast is gently pressed between 2 plates for a few seconds. It can feel uncomfortable, but it's over quickly. When and how will I get my results? You'll normally receive your results by post within 2 weeks. What happens if my results are unclear or show an abnormality? You may be invited back for more tests. Most people called back do not have cancer. Are there things I can do to reduce my risk of breast cancer? Keeping a healthy weight, drinking less alcohol, staying active, and attending screenings all help lower your risk.